Hi everybody, this is Dr. K from Holistic Minds. Today I am so proud to be introducing Dr. Sami to you. She is a brilliant dentist, an orthodontist who went to Columbia Dental School and then ultimately went to UCLA to do her pediatric residency in dentistry and orthodontics. You're actually a faculty now. And you know, I love the work that Dr. Sami is doing because you're truly one of the kind. You're the pediatric dentist, you're the orthodontist, and then somehow you integrate all the osteopathic medicine into everything that you're doing, which I don't know of anyone else that's doing that. Is there anyone in the country that does what you do?
Well, Dr. Nordstrom, my mentor, was the one who kind of introduced like that, how osteopathy could be, integrated. But, so, and then there's other dentists that they bring. I think the uniqueness will come mostly because I have so much passion with working with children. Most of the other dentists, they have a more adult orientation, and they see some kids, but it's mostly an adult practice. So I exclusively see children. Once in a while, some adults here and there, people that I love and adore. So, but it's mostly an exclusively pediatric practice. So I think that's what makes it a little bit different. But
well, thank you for doing what you're doing. And, like some of our other speakers, I am so grateful for how much I've learned from you, because I have to say that, understanding that the mechanisms of the mouth and tongue ties and lip ties and whatever 4 or 5 years ago, would have just gone right over my head. The obvious tongue tie, that any blind person could see, I could see.
Right at the tip of the tongue.
Like that I could see, but anything other than that, it was like, and then over time, as you've helped me see these cases, and I've seen, the near miracles you've worked with, some of the surgeries you've done, each time I'm like, oh my God, how did I miss that? Or how did I not know that? So I'm really grateful. I'm really grateful. And I'm happy that you're here to share your wisdom with our audience, because I think they really need to know of the type of work that you do and the possibilities that are available once all of the mechanisms of the mouth are addressed.
Right. And I'm grateful for people like you who are open to learning. Because there's a lot of times that I interact with physicians and they're so closed in learning new stuff, or kind of coming out of that paradigm of what they learned in medical school or what they learned in residency, that they're not really opening themselves up to learning new things. So it's such a pleasure to work with people who are just as passionate as I am. I think I'm going to keep learning until the day that I take my last breath, and have that curiosity, because I think without that curiosity, we all kind of stay still. And then not only we're doing a disservice to ourselves, but more so we're doing a disservice to the children, because this dynamic, incredible, precious body, it's so complex that unless we just kind of talk to each other, we learn from one another, and we collaborate, we're doing a disservice, and we're not really being the true advocate for children. So thank you for remaining curious and listening and, asking questions. And it's just such an amazing thing to be working with you and collaborating with you with so many patients, so I wish more pediatricians like you in the world. So,
well, thank you. But, it's, if we stay in our own box, we ultimately can't be of true service to the kids. And part of why I've started creating this entire Holistic Minds program is I've realized that people need the team.
Yes.
There's so many different issues that are causing imbalances in the children. And, I've personally seen at least 10% of the kids that come to see me for, anxiety, ADHD, whatever. Ultimately, it's all originating from the mouth. And I've had a few cases where, my own jaw dropped when, they came to see you, and then they ended up having a tongue tie. And then I'm like, how in God's good earth was the tongue tie related to the kid having ADHD and anxiety, and everything is interconnected. And that's one of the things that I've come to learn from you.
Yes. Thank you. Well, I think that, a lot of times our children become the blessing that they keep teaching you. So Hafez is going to be almost 12 years old next month, which is, I'm so baffled by it. But 12 years ago, when I had Hafez, I had a difficult time breastfeeding. And I went to 17 different kinds of practitioners, you know, from lactation consultant. At that time, we didn't know you. I don't know if you were practicing in LA area, but anyways, like, so we, you know, we went to other pediatricians. We went to so many different people to find out why he can't breastfeed. And the answers were very simplistic, you know, answers. Well, you know, you don't have enough milk. You don't, you know, it's like it. There was one pediatrician, actually, he went as far as saying that he's trying to punish you because you're a working mom. And so all you need to do is just quit your job and stay home and just breastfeed him all day long. And then the problem is going to go away. I mean, just really bad advice. And I was sitting so frustrated. And of course, the first time mom, you feel ashamed. Why can't I feed my own kid? You know, you feel frustrated because like the kid is losing weight and you don't want them to put him on formula, you know, all of these things. You know, the formulas have their own spaces, but, you know, I just really wanted to find out what's happening, you know. So, you know, which, you know, my mentor, Dr. Nordstrom, came over and it's like, oh yeah, he has a tongue tie. What's a tongue tie, you know? And, you know, I realized that my education was not even to the point that I could even understand all the concepts. So he kind of worked on him a little bit and then released the tongue. And literally within 24 hours, after 5.5 weeks, my milk started coming, you know. Wow. And it was such a transformation, you know, in terms of the paradigm shift. You know, that's something that I went to some of the best schools, you know, like, you know, from Columbia to UCLA. Then I was a, you know, faculty over there. And, you know, so, and I also, you know, did the children health advocacy training there with the pediatric department, pediatric medicine department. And I had not even heard of anything like that. So, yeah. And so that started the whole thing of like, okay, let me just at least be open to it and at least see that. So without anything, you know, how like when the student is ready, the teachers, they show up, you know, all of these kids, they started, you know, out of nowhere coming to me with breastfeeding issues. And so we started looking at all of those things. But I think that over the period of the last 12 years, because, you know, I started training in osteopathy. So I started feeling like, oh, it's not just a clipping of the tongue, you know, it's so much more complex than that. And working with so many of my amazing osteopath and craniosacral therapists, just the curiosity just kept developing. Then working with our couple of developmental pediatricians, working with people that they are sleep specialists, working with people that they you know, look at the gut and their health, you know, like they really concentrate on the gut health, you know, and looking at the profile of some of these patients and seeing how they intertwine. Mm-hmm. I don't know which causes which, you know, which one is the chicken and which one is the egg, but to me that it does require a more holistic, you know, I always say I practice holistic pediatric dentists and orthodontics, and it's not a HOLI, it's a WHOLI, you know, and it's unless you be able to see the whole child, and that, you know, says just like the osteopathic training, it's mind, body, and spirit, you know, in the entire, not only the child, also the matrix that they're in it, which is the family, you wouldn't be able to get as far as you want to get and be of service in a profound way. Absolutely. You know, I also had the blessing of so many children like that I released their tongue, let's say with a scissor. And then because they were my patient for the next, you know, 12 years, I get to see like, oh, that wasn't a good enough release, or that wasn't a complete release. This still not working, or that release didn't quite work with the whole, you know, symmetry of the cranium, and or they're still having some issues with the speech, or they're still having some issues with the way that their tongue is working. And if the tongue is not swallowing, the cranium is not developing. And if the cranium is not developing and their airways are being compromised, then they're not sleeping well. And then if they're not sleeping well, they're not draining the brain and, you know, creating that lymphatic drainage on a nightly basis. And then they're also their capacity for life and their tolerance, just much like a new mom that once they're sleep deprived, they can't focus, they can't sit still, they're exhausted, they can't really multitask. The same way these children for the past 7-8 years, they haven't really slept well. They're exhausted, so they can't sit still. And like there's so much that it's kind of intertwined. Their digestive system is completely changing. So I just remain curious, and I ask a lot of questions, so in the first time that I see the parents is usually about an hour to an hour and a half of evaluation as well as history taking. So it was almost my classroom and my, I don't know, like these parents, they taught me so much. These children, they taught me so much, because I started becoming like, oh yeah, this issue and this issue and this issue and this issue. All of the kids with tongue tie, they're presenting at the same time. We were talking about it, like the moms, for example, that they have an excessive amount of, milk, and the milk just kind of, you look at them and the milk comes, then they have their baby at the tongue tie, but it doesn't present until 4 months. Why 4 months? Like all of a sudden there's like this rush of all these kids at 4 months that they're getting constipated. They are not breastfeeding as much. The latch is different. They're losing weight. There's all these subtle things that it's happening. So I don't know. I just kind of keep asking, keep learning, keep, working in a team approach, because I think that's a really, really important aspect. Keep going to like completely random, seminars that are not necessarily for dentists, from like OT and, osteopathy. It's been my passion. I quite often always say, like, I wish I was an osteopath, because I just find it so fascinating. But over the years, I feel that, and I actually think with everything that I have learned, and I've said that quite humbly, I feel like we're just at the beginning of understanding how this little thing called tongue tie, lip tie, or how the cranium and the way that it all works together, and the fascia all the way down to the toe, and how the restriction happens, with at the cellular level, how it works. I think we kind of took a simplistic approach initially, like, oh yeah, it's a tongue tie, let's release it. No exercises, no cranial work. Now, like, both my pediatric practice, as well, pediatric dentistry practice, as well as my orthodontic practice, they have to be with a craniosacral therapist or an osteopath. Right craniosacral therapist and right osteopath, I have to say. So, because without that, I can't really accomplish to the full potential that I can. Orthodontics, in my opinion, it's more like the allopathic and the traditional medicine, where it just treats the disease. It just, basically pushes the teeth to a straight point and then gives you a retainer for the rest of your life to wear. But some of those subtleties, that it's the baby that came in with a vacuum, and then there's an asymmetry when you're putting a straight wire and you're putting the braces on, or you're putting an expander that just expands evenly on both sides and pushes everything, it actually makes all those asymmetries so much worse. So I feel without really me understanding how does this body functions on a whole level, I will be doing more harm than good for the child when I'm trying to straighten the teeth. Yeah. So that's basically like the whole gist of things that I do.
No, I mean, it's perfect that you touched on this, because it takes a village.
It does.
It takes a village to really help these children. And
yes.
There's one thing if you are looking for the pill to fix something, but
right.
to truly heal these children and allow them to regain their God-given functioning, to allow them to function optimally, it really takes a team. And this Holistic Minds program is really an online team,
right?
Where anyone anywhere in the world can basically get access to the team,
yes,
and then ultimately figure out how to assemble their own team locally to help heal the child.
Yeah, and I also have to say, I don't think a pill really fixes anything.
No.
I think a pill, you know, momentarily or for a period of time compresses something or just kind of shuts down a system, but then eventually it has like much more downstream effect. So if you really want to heal something, it takes much more than just one pill. You know, you got to get the system to work optimally. And it's not necessarily perfectly actually either. You know, we have this thing in our clinic that we all say function actually precedes structure a lot of times. You know, so if you can get the function, the structure changes. You know, so and you don't have to. We have people with certain limitations that they're functioning beautifully. And we have people that they're structurally, it's all sound, but then because the function is wrong, like, for example, the breathing is not right, they're completely in a sympathetic overtone, then the function, the structure doesn't make any difference. It actually affects everything else, so.
Well, let's touch on that if you don't mind,
Sure.
Because you first touched on, how just straightforward orthodontics, the way it's practiced, may not actually be so great. So let's just play out some scenarios. Let's say we've got our 8-year-old boy who is having ADHD, anxiety, plus or minus, whatever other diagnoses they've earned. And this was the guy that had the vacuum birth, had whatever other issues, ultimately had really maybe an impact, like tooth impaction, crowded palate, like they had to pull some teeth. Ultimately, they put the braces on, and now he has normal teeth, but he's dysfunctioning or malfunctional in his classroom.
Right.
How would all of this be tied together from your standpoint, and how would the crowded teeth and the braces and all of these other things ultimately have impacted this child's nervous system?
So when I look, first of all, my optimal patients are infants. So I love for infants to come in because most people, they think like, what do you do with infants? As a pediatric dentist, they don't have teeth. And then as an orthodontist, they're not, they say like 6 or 7 is the time to see your orthodontist for the first. I feel by 6 or 7, so much stuff has already been done that, we could have prevented it in the first place. So when I see my infants, I actually look at their structure, like how was the birth, what is, I feel them osteopathically. What happens is, do they have the torticollis? Do they have, because when you do have torticollis, literally your jaw development is completely different, right? So if I can tell like, and many physicians, I don't see them to diagnose torticollis right, unless they're osteopathic physicians,
That, and what I find is a lot of times these kids will be sent to the PT or someone.
Yes.
They just do some stretching to at least seemingly get the neck to be moving. And a lot of times I find like it wasn't truly released. Like the actual issue wasn't taken care of.
Exactly.
And now they're 8.
Yes. And so when I start kind of like evaluating all of those other issues that they are going to make, and I call it my job because, I feel like, they're all my kids, like they're making the jaw actually completely grow asymmetry, or they're creating issues down the line. I start dealing with them much, much earlier, right? So when that child, for example, has torticollis or has had vacuum or C-sections or some of these things, there is some kind of asymmetry or compression, or strains that has been created. And it could be not just here, it could be, somewhere down in the sacrum even, because there is like basically our body is one, so one plane is off, the rest of the plane is off. So quite often I actually have few scoliosis patients that the scoliosis on their spine mimics exactly the cant on their teeth.
That's
right?
crazy.
So if I'm fixing this without really being mindful about the scoliosis, I'm going to make not only here worse, but I'm going to make this scoliosis worse. So, or I see a lot of kids with, I watch kids walk, many kids that they have the knees actually coming in and everything and the laxity of the joints or hypotonicity, I also see all of those things in here. You mentioned Dr. Dolgen. Actually, one time I was in his office and he was looking at the feet, you know, and the curvature of the feet. And then he kind of looks at me and is like, this kid has a very deep palate. I'm like, what does that feet has to do with the palate? He's like, yeah, when the palate is very deep, the curvature of the feet doesn't actually develop. So it compensates, so they have more flat feet. So there is so much that we can learn and collaborate with the rest of the body, that it could be caught, like if you have had the training and you have the eyes to catch it, that you can prevent that kid from ever having braces, right? So what happens now, the 8-year-old is coming for a consultation, let's say, and they're looking for straight teeth. So I look at what didn't happen, because we were intended to have nice, beautiful arch. I do not believe in a mouth that, the mouth is too small genetically and it doesn't have enough space for the teeth. I don't believe that. I think genetic is a very, very small aspects of it. However, the whole aspects of the crowding is very much the basically the disease or the dysfunction of something that didn't work. Mm-hmm. Was it the breathing? Was it the allergy? Was it the, you know, hypotonicity? Was it the laxity? Was it the birth? You know, so I kind of look and start, you know, by asking a lot of questions, by doing the exam, by feeling, by palpating, all of those things. I try to figure out what was it in the history of the child that is giving me, you know, the why question rather than how question, mm-hmm. that is giving me this crowded, you know, mouth that doesn't have enough space for all the teeth to come in. And yes, I might expand, not those with just gigantic, crazy, forceful expander, but with a much lighter expander. But I try to get the rest of the body to collaborate. So if it's a tongue that is not functioning well because it's sitting all the way in the down on the bottom of the mouth, rather than presiding on the top, the roof of the mouth, and, you know, 1,600 to 2,400 times a day, swallowing on the top and back, and basically expanding that palate transversely from this way, as well as anterior, posterior, as well as vertical, all of these things. If it didn't, then I have to work with a myofunctional therapist, which is a person who teaches them how to swallow correctly and how to do that. If they have it, the reason that they're swallowing that way is because they have had a tongue tie or a lip tie. So they're compensating with neck and hyoid is up and then pulls out the diaphragm, and then the neck pulls down, you know, C2, C3 kind of, the vertebrae kind of starts turning. All of these things go together in terms of creating that scenario. So to be able to just kind of say, oh, I'm just going to expand you and I'm just going to straighten your teeth, you know, it's 22 bones in here. You change one bone, it's like a pieces of puzzle, you know, like you can't do it without changing the rest of these 22 bones as well as the rest of the body. So you look at these things and how you can actually, you know, make everything together work, you know, harmoniously.
Well, I really appreciate you touching on that, because, you know, there's two things that I've seen. One, it's staggering to me how many of these kids have posterior tongue ties that have been missed. And I would venture to guess to say that at least 30% of the kids that are in this population of kids with behavioral issues actually have metabolic errors.
Yes.
So these are the kids that have low tone. They, you know, in the older kids, we see them, they tire often, they have low stamina, low energy. But one of the things that I've been shocked to see is that in the babies, it impacts their tongue tone. Yes. So they have low tone in their tongue. Absolutely. They're also the floppy kids. They don't crawl very well, blah, 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 which creates a whole different can of worms. But so you're saying if they have low tone in their tongue and that tongue was not thrusting appropriately to expand the palate, that could be the reason why ultimately they end up with crowding.
Yes, absolutely. That's one of the reasons. And I also want to, you know, because you mentioned that a couple of times about posterior tongue ties. So just for your audience, in case they don't know, But like the anterior tongue ties is the obvious ones that the tongue is actually like basically you see the tie underneath.
So it can't come forward, right?
Yeah. Well, the anterior is like basically it's like right at the tip. So when they open their mouth and they stick their tongue out, the tongue does not come out. Those are the obvious ones that everybody says, yes, this is a tongue tie. You know, then there is a little bit further back, which they call it class 2 based on one of the classifications as well, you know, which is they can take it out, but it just takes so much strain, you know, to take the tongue out. And then there's class 3 and 4, which are like posterior tongue tie, which the tongue can completely come out, but it can't, the back of the tongue cannot lift up properly. And it's such an important aspect of swallowing and airway protection. So the posterior tongue tie kids are the ones that I see that it starts, first of all, they develop a lot of gagging reflexes. And the normal gagging reflex is there's no such thing as normal gagging reflex unless you actually go and almost get to the pharynx part. So when you see a kid that is like, as soon as you touch here, and they start gagging, or as soon as you touch here, or as soon as you touch the tongue, they start gagging, that's a protective mechanism because they can't lift the back of the tongue.
Wow.
So now, like, they are compensating by that gagging reflex in order to be able to protect their airways, you know, because the airway is everything, you know, so the gag reflex automatically tells me that there's something in the airway that is compromised. And this kid is actually compensating. So whether the delivery, you know, had some issues, you know, or that there was a tongue posterior, there is a tongue tie, posterior tongue tie, you have to kind of like, that's already an indication that there's something going on with the airways.
Is there a way for parents
to see that obviously? So is it just
how well the child can lift their tongue
up?
No.
You know, I think that's another thing, because there was so many miseducation, you know, and misunderstanding about tongue tie. Because, for example, like I'm tongue tied, you know, so, and I'm going to go to Zoggy, and that's probably the only person that I would trust at this point to fix my tongue tie. But other than Nordstrom, who is too busy. But opening that, when I open my tongue, when I open my mouth, I'm able to actually lift it up all the way to the roof of my mouth.
Okay.
But the way that I do it is, first of all, by lifting up my entire floor of the mouth. My hyoid comes out. My C1, C2 literally gets kind of like subluxated or rotated to the right. So I use my neck, my floor of the mouth, and my TMJ. And then after a few years, my TMJ started clicking and the asymmetry and all of those things. It's a struggle. It is a struggle. So I think just opening up to the roof of the mouth is not an indication. One of the things that I do with those cases is I actually hold the tongue at the base of it, in the bottom, without allowing the floor of the mouth to come and compensate, and I see what happens. How much can they actually lift up? If they cannot lift up that much, and the tongue actually curves or curls around or becomes cup size, I know that that's a posterior tongue tie. Okay. So that's one thing. And then you can also like feel it, you know, it's like when they lift up the tongue, it's almost like a guitar string, you know, like it's not when they actually lift it all the way to the top. Like it's, when you touch it, it's not a very smooth move. Okay. It's almost like you can play guitar on it, you know. So it's very brittle, and like there's tension in there. So you can also feel it like that. With babies, a lot of times you can see like when they cry, you know, and they're like, sometimes I say, I'm so sorry, I don't want like the baby to cry, but then at the same time it gives them like, it gives me so much information. Because when they cry, you can see, does the tongue cups like this, you know, or does the tongue goes all the way to the roof of the mouth? Wow. And it's amazing. I actually have videos of like before and after where like it was just kind of cupping a little bit, and then like as soon as you release it, it just like the tongue all of a sudden goes to the roof of the mouth. So you can, and some of the babies we see, they don't even, like the tongue doesn't even lift up at all when
just like stuck.
It's just really stuck. And those are the babies that you literally can see in like their pupils and their mannerisms, like very, you know, even 2-3 weeks old. they're just tense, and then there's a lot of like sympathetic overtone, you know, the fight and flight, and so they're colicky, but also there's almost like this fear factor that you can literally see in their eyes. Yeah, it's amazing. Wow. You know, and you see like their tongue is stuck in the bottom of their mouth, and the front of the tongue is moving, but the back of the tongue is like pulling everything down. Yeah. So those babies, you know, I don't do the frenectomy unless, well, actually most of the baby, like all of the babies, I don't do the frenectomy on the tongue unless there's some cranial work and there's body actually has been taken care of. And I have had so many parents like, oh, I can go to so-and-so and get it done today. I'm like, I'm sorry, I don't think that that's the best thing for your baby, because you need to first open up all the other aspects of the body. Otherwise, when I'm releasing the tongue, I'm actually creating more asymmetry, because when you release it and the way it attaches, they have done studies at Columbia University where they saw that the side of the torticollis, the opposite side actually reattaches more than the side of the torticollis. So the tension, the way the asymmetry of the torticollis, it actually affects the tongue reattachments and remodeling. So I have to work with the parents first in terms of the whole body before we do that. Yeah,
because otherwise you can actually, I mean, you may not be making it worse, but you're not necessarily helping them as much.
Yeah, they might be able to breastfeed, you know, so a lot of people, they kind of focus on that breastfeeding. I feel like the breastfeeding is just an indication of that there's something that is not going right. And sometimes, as I talked about with women, that they have a lot of, you know, milk, what happens is the baby just kind of latch in and just uses them with the wrong muscles, you know, because you use a different muscle when you're breastfeeding, when you're bottle feeding. So when they're just using the mom like a bottle, basically using those muscles, and when those muscles they get developed, then there's like airway issues. There's also like the jaw development and all of those things. So it gets missed, but that the child still has a tongue tie and lip tie. So it might be the breastfeeding is an indication, but not necessarily the rest of the thing. Is how this whole system develops, you know, and how the child sleeps and how the child's speeches is, and then also how they can eat. Yes.
Because one of the things that I use as a general rule of thumb in terms of how much of an issue there is how efficiently a child can eat.
Yes.
So if it takes them 45 minutes to an hour to finish a simple meal, chances are there's something there.
Yeah.
If they have history of choking on food, pocketing food, those are signs.
Right.
If you've got the older child that is the very picky eater, can only handle soft texture food. So, you know, like my one of the things, assuming they're not vegetarian, is like, okay, what happens if you give your child a piece of steak?
Yeah.
You know, and for a lot of families, they're like, oh no, Johnny never. He or she never eats steak because every time they do, they just spit it out, or he's choked on it, gagged on it. So these are all signs that there's some kind of restriction likely in the tongue. And especially if they have speech issues, like you mentioned, and so forth, that this could all be the problem with the mouth and the tongue.
Right. And sometimes I see the opposite also, kids that they cannot have any puree because they cannot actually control the tongue in terms of like how much it goes into it. So they stay breastfeeding for like 1.5 years, 2 years, because they can't even control their puree stuff.
So the not eating purees, not being able to eat purees could be another sign.
It could be another sign, you know. So
okay. Didn't know that.
Yeah, it's all like how the tongue is actually maneuvering and handling food, you know, because our tongue is supposed to be like, oh, how much it actually goes back, how much it stays front, what you're doing, you know, and then, you know, our teeth, like anthroposophical medicine and like Rudolf Steiner talked about, you know, like the anterior teeth, the development of the anterior teeth, what is it with like basically the developmental ages and how everything develops, and what foods they should be eating when the canines they come, when the molars they come. It also has to do with, I also look at it as a lot of people that like, so when should we start the pacifier? When should we start the breastfeeding? And not to go into your area, but, you know, in my standpoint, as far as the dental development and as far as the craniofacial development, I like there's three stages of the swallowing. There's the stage that it's called an infant swallowing, when there's no teeth, and they basically kind of thrust the tongue outside, a little bit outside and forward and go up. There's the transition swallowing, which when they get their, you know, 4 upper and 4 lower teeth, that the tongue actually hits the anterior teeth and then goes up. And then there's the mature swallowing, where it goes when the molars, they come and they touch, and that goes up and back. So, and that actually develops the vertical aspects of the airways. So each child, that can change from 1.5-year-old when the molars come in to 3-year-old when the molars come in. So I feel that that is an indication when to take the breast, or when to take the pacifier, and when to take the bottle out, because your child's development, just like one person, you know, starts walking at 10 months and one person walks like, you know, 16 months, you know, and there's just a range of, you know, timing of it. The same thing, the teeth are like different range of that, and they will tell you when developmentally. So you look at the molars, and when the 2 molars, they touch on the top and the bottom, that's the time that to take those things out, because usually those things, they keep enforcing the infant swallowing. So the tongue thrust that we see, yesterday actually I was seeing this ad with this in the orthodontic journal, with these gigantic, like really big pokey stuff that it comes in, and you know, and basically every time your tongue comes in, it just kind of shocks it, because it's so you know, it looked like a torture device, which we were taught, you know, and says, oh, how to start, you know, how to stop tongue thrusting. That's not the way to stop tongue thrusting.
That doesn't sound very cunning.
So, but it is part of some of these things, like how do you train it, you know, and developmentally.
In terms of tongue ties, so we touched on like the eating issues, speech issues. Now you had taught me, and you kind of touched on this, but I think it's important for the audience to be able to look at other things. So if the child had reflux, if the child has constipation now, those could be signs. Neck pain could also be a sign. Other physical signs that the child may still have a posterior or some kind of subtle tongue tie that has been missed.
Yeah, that the gagging is very, very prominent. So like I actually go in there and see what their gagging is. I look at like how they suckle, you know, because as you know,
like if we've got an older child, let's say
with the older child. So what year are we talking about?
6-8-year-olds.
Okay, I look at like let's say 6-8-year-olds comes to me. I ask a lot of detailed questions about sleep. You know, so I said, how does your child sleep? Oh, they sleep like a rock. They go to bed at 7 o'clock and they wake up at 7, you know, and then meanwhile, like you're seeing all these like dark circles under. And then you ask the child, like, oh, so when you wake up in the morning, do you feel like you're ready to go, or are you still sleeping and you want to get some more sleep? Oh, I'm still a little tired and I want to get more sleep. You ask the mom, like, so what happens at this sleep? Does he sleep solid, like in one place, or is he all over the place? Oh, we can't even sleep next to him. He's just like kicks and goes all over the place. Does he, you know, still, you know, have diapers? You know, when he's, you know, up to like 5-6 years old, he still wet the bed at night. It's usually the nighttime thing. You know, some do, or some of them they go get up to go to the bathroom. They shouldn't. You know, at that time the bladder should be fully formed where they can, unless they're like having tons and tons of water. Yeah. Do they feel dry mouth in the morning? Do they do they have like this like little jittering of the feet, you know, where like they kind of like just their leg just kind of jitters like that? Are they mouth breathing? Do they snore at nighttime? Do they have postnasal, you know, or a little bit of congestion in the morning when they wake up? Do they so some of those things I ask a lot of these questions, and I get like, okay, there's something again about the airway that it's not right. So then I feel like, is this the tongue tie, the posterior tongue tie, or is it just like the child has, you know, congestions and allergies and all of those things, which I actually believe that when you're a mouth breather, you have more propensity for allergies and a lot of the respiratory stuff, because you're not really. Oh, the other thing is I ask how they sleep, because there's so much, a lot of kids, when they have airway issues, they like to kind of go on their side because they open up their airways, and they kind of like really like either go like this, or younger kids, they go like this, older kids, they go like that. So I have the parents actually to take a picture of them when they're sleeping.
Interesting.
So they also, a lot of younger kids, they like to have like a blanket really close to them, because when they're mouth breathing, they're getting this cold air, but then like the blanket actually humidifying the air. So there's so many little pointers that you can actually find what's happening, that how are they compensating, because our body is so resilient, right? The new thing that I started doing with some of my older patients is to bring a baby picture. And the pictures going to upper lip tie, all the kids that they have upper lip tie, well, not all of them, many of them, when they were a baby, they had like this grumpy look.
No way.
You came to the delivery of Hannah, and I don't know if you remember, but the first few weeks before we actually released her upper tie, her lip was really, really tight, my second kid. She had like, I was like, oh my God, she's so serious, or like they would make comment like, she's so grumpy, and it was just like this whole mid face was really compacted. And I had the most amazing pregnancy with osteopathy. Well, it was a stressful pregnancy, but I had osteopathy during the time, and then the delivery was pretty easy, and afterward, but this got really compacted because of the upper lip. And then so she had literally, after we released this, and we had Dr. Gill actually opened her face up, like, I mean, she looks like a completely different kid. She doesn't have the grumpy thing. So it's really, so I'm having the parents to actually bring the baby pictures, because a lot of times the baby picture, they give me a lot of information about some of those things, because sometimes it can start growing in a different way that compensates, but then you don't see the initial problem that was there. So.
How would lip ties impact the functioning of a child, especially like an older child? Because you touched on the tongue and how it causes all of these different dysfunctions.
Yes.
How would the lip tie be something that parents should be aware of? And that's obvious to see. If you flip the lip up, and if there's a tidal band, usually they've got a gap in between their teeth.
No, not always.
Not always. Okay.
Not always. Not always they have a gap. Sometimes actually there's no gap, and there's the teeth are like this, and we literally see that when I take my ICAT, I see that the upper lip tie, it has pushed the roots on the side as early as like 3-4 years old. You can see that. So sometimes it's actually an opposite. It's like that. That's like the lip tie has done. What we have noticed, with the changes and the differences in that, definitely the sinuses makes a huge difference. So when I have a kid with an upper lip tie that has been remained, or in some cases the orthodontist is like, oh yeah, don't worry about it, I'll close the gap and forget about the upper lip. I see that the sinuses really didn't develop, because it's almost like a little pool, right? Mm-hmm. So it was the sinuses, which are the zygomatic arch and the maxilla coming together. They basically, like, it was very, very narrow and V-shaped. So orthodontists, they came and they made it U-shaped by forcing the teeth into these places and keeping it with a retainer. But the sinuses, they never develop. And I have some of these patients that years later, they're actually coming and they are getting, they're getting all of that expanded already and releasing their upper ties and things like that.
Would these kids have more sinus infections?
I would say, yeah, they would. I see that's the most common thing that I see.
Gotcha.
But I also see, for example, some of these kids with the upper lip tie or the buccal ties, that we're looking at, there's also a strain on one side, and there's creates an asymmetry in the face. It goes. What we're looking at is this tie. It literally goes all the way to the back of the at least the cranium, and then we're finding all these cool stuff with the rest of the body too. So and we're still learning. It's like we find a lot of times the upper tie with the left kidney. I don't, the visceral aspects. one time I have to show you this incredible video with how they actually dissected all the visceral and then all the way down to the toe and how things are connected together. So I think that's one part. I remember when we were in anatomy class, we just kind of took all the visceral out and we just dived into the organ. We never really learned how the visceral is all connected and how the tension on one part creates the tension in another part. So we're still learning in all of those aspects of things.
I appreciate you talking about this because I think that that's one of the key parts of this entire discussion. Everything is tied to one another.
Yes.
And one restriction in one place can mess up something else, which then messes up something else, which then, and then next thing you know, you've got a child that's going haywire.
Yes.
One of the things I remember,
or not. Sometimes like they just compensate and they become this kid. I had a kid that she came to me 3rd grade. So 2nd grade, she had a really, and I knew this child since she was 2, but I didn't see her for a year and a half. So 2nd grade, she had this really mean teacher that constantly shamed her and created a lot of anxiety. So she started thumb sucking 2nd grade and completely like messed up her whole jaw and everything else. So, but she was still the top of her class. She still, did everything in the way that her parents expected her to. When we started opening everything up, like all of a sudden in one of the cranial sessions, she just started bawling. Like this was 4th grade by that time, just crying for almost an hour, saying like how hard it is for her to constantly keep everybody happy and to be the perfect student and to be the perfect daughter and to be. So there's also the other, there's some of them that they don't go haywire because they're trying to keep everything together, So that's another things that we see. But when we feel the patients or when we're looking at them, like, are they operating on a relaxation and once in a while kind of a stressful situation, or no, this anxiety is all the time? We're now actually putting, the first thing we do, I just got a heart rate monitor, but we're just going to start doing like heart rate variability, and then we also do capnograms, so we actually see how they're breathing and how much carbon dioxide they're releasing, so we can actually see what is this system beyond what they're saying, like it's working at.
It's amazing.
Yeah,
it's amazing. What else do you think our audience should know about just how the tongue and the mouth and everything could be impacting the child and ultimately, their ability to function, their performance in school? Because obviously that's another thing. It's not just, does my child have anxiety? If you've got a child who may have a high degree of intelligence, but they're actually struggling in school, like that's obviously a huge impact.
And digestion. I would say, I would really say that what I see with almost 90% of the kids that they're mouth breathers, they also have digestive issues, and that's why I send them to you. So, because what happens is when they're mouth breathing, they're basically getting rid of too much carbon dioxide. When they're ready, and everybody thinks carbon dioxide is the bad guy, but it's actually not. It's kind of like the bus driver of the oxygen, right? So when you release too much carbon dioxide, your body by nature goes to an acidic form, So the digestion starts shifting. Then like that whole mouth, the peristalsis of the tongue, it's also the initiator. We kind of forget that this and the mouth and the anus, they used to be one whole, and then it's just kind of like extended to 2 different directions. And then the way that the tongue moves, a lot of times it initiates the peristalsis in the whole digestive tract. So I also see them with a lot of digestive issues, picky eaters, I see a lot of times with large tonsils, and the first thing that they want to do is to take the tonsils out. But that's not going to really help anything. It's going to temporarily take the problem and open things up. But if they continue mouth breathing, those tonsils, they're going to hypertrophy again, and they're going to get large again, So looking at now, the tonsils are trying to do the job of the cilia of the nose, and so they're getting larger because they're trying to filter and clean out the air, so they're getting larger and larger. and then now they're obstructing and doing all kinds of other things. There's also like the understanding. Actually, I'll give you this interesting. I had a dad that he was a lawyer, and I did not like it at all when he came. If you're watching, I'm so sorry, but I did not like it when he would come to the practice, because he would just pace back and forth and like, and I hold a lot of space for my families and for my kids. I never force any kids to open their mouth or say, okay, it's 5 minutes is up, you didn't open your mouth, like your appointment is over. So there's a lot of spaciousness, but he would just pace back and forth, so much anxiety. And I kind of was like, yeah, he's just a lawyer. With all due respect, they have a very stressful job, and that's like how they run. And so a few weeks later, after we did all these myofunctional stuff and, this work with her child, he's like, oh, I want to come and do this with you. Can you release my tongue tie? I'm like, oh my God, it's going to be it's going to be worse than the kids on the chair to release this man's tongue tie. So he did the myofunctional. I said, yes, because I do believe in like the matrix of the family creates. If a dad has anxiety, the mirroring, it just, it creates anxiety in the child by nature, because that's the it's basically the fish that swims in that water. So I said yes, and released his tongue tie. The mom called me in 3 weeks, and he said, you just saved my marriage.
Wow.
And I said, what did I do? And it's like, oh, he had so much anxiety that I was about to divorce him because I couldn't stand it anymore. And somehow, I don't know, like with this whole aspects of like releasing his tongue tie and his proper breathing, like he's like a different man, So I started looking like, why is this, and so many adults actually, they report the same thing, that once they get their tongue tie released, like they feel the sense of opening in here, and then their anxiety goes away. Most kids, they don't even know what anxiety is, so they don't talk about it. But adults, by the time they find out, like then they can express it. But when you can't lift up your tongue and protect your airways, you're automatically put on into a fight and flight. So you're already in that sympathetic overtone, and that's basically the autonomic nervous system that is running in the background all the time. So when that happens, it's like basically you're in a state of being that it's constantly fight and flight, and you don't even know it.
Like, you can't relax.
Yeah,
ever.
You can't relax. So they're even looking at moms that they're in that state, and then how does that affect the baby, and when the mouth breather moms or the moms with airway issues, how does that affect their babies and in utero, and is there a correlation with so many other things? So that's like kind of like the newer aspect of the research that is going on. But that's part of the whole things of like, how does this anxiety and how does this whole autonomic nervous system can be part of it's not always, but it could be, that's one of the things that we look at.
I appreciate you saying that, because one of the little demos that we do for on Holistic Minds is basically show how everything is tied together.
Yeah.
How, because a lot of people I see in my world just focus on the gut. They're like, if you just do gluten-free and just do the probiotics, magically everything gets better. And that's not the case. Yes, the gut is important, but everything is important.
Yeah.
And if people can really learn how everything comes together for their child,
right.
And I think through, a lot of your teaching and the teaching of Dr. Gill and others, one of the things that I've realized is I can spend all day fixing the gut. If the kid has a tongue tie, they're not sleeping well, they have restrictions, that's all effort wasted.
Yes.
And
the same token, like if they have the tongue tie and I release it, but the kid is eating crappy and their gut is not healthy, then the jaw doesn't develop properly.
Yeah, and everything has to be tied together. But we also have to understand all of the pieces that went into place that have ultimately caused the dysfunction that's there.
Yeah, absolutely.
Thank you. Thank you so much for sharing all of this. I mean, this has been of such huge contribution to everyone.
Thank you so much. Thank you. I love doing this work, and you saw like I get like so excited about it. So, but it's such a privilege to be able to continuously learning and then from each other, and as well as like collaborating together, so we can learn from one another. We've had many conversations, and like So what do? You know, what, like when I see a kid with a laxity of the joints from the get-go, like what are some of the things that we need to be looking at and to kind of prevent some of these things that happens, or you know, how can I help the mom that has this issue? So I think like the more that we work together and collaborate, it's not only fun, but it's just so much more fulfilling, because then, you know, you're asking the why and the why and the why, and then you're coming back to miracles that I know that you see every day, because I see them every day. I mean, this child, like from not speaking, not eating, not thriving, all of a sudden it's like the child is like skipping grades and like in the sports team, like just completely shining. And everybody had told them that, oh yeah, he has some issues, he probably has to be held back and go to this kind of a school, and all of a sudden he's like the top of his class. And I don't know, I don't think anything more fulfilling than some of those cases that we get to experience every day.
And you know, I think that's the gist of all of this. When you look at it holistically, what seems impossible becomes possible.
Yes.
Because you're dialing in all the right pieces for that child.
Right.
And you know, it's so funny you shared that, because I have one little girl who's now 9, who the teachers, before they came to see me, the teachers are like, yeah, you know, we think she may have to be held back. We're not sure if she's a right fit for our school. Because, you know, she's not totally there, whatever. And long behold, like I stumbled on this after like the 3rd visit, where the mom is like, yeah, it takes her an hour to finish a meal. I'm like, oh, that's kind of strange. You know, and then sure enough, she had the tongue tie, and we did the work and got a release. We did some of the osteopathic work. And then 3 or 4 months later, she had jumped 2 grade levels within like 2 or 3 months, to the point where the teachers were all astonished. And now she's at the top of the class, like literally she's doing the work with like so much ease. And the mom is like, wow, maybe I should even be putting her in another school. But there's so much that's possible when we look at all of these elements and allow the child to not be tied down and shackled by whatever dysfunction they have.
And look at, you know, the other part of it's like, look at the entire thing. The more we learn as practitioners, because for example, like I started learning like a couple of years ago, 2-3 years ago, about primary reflexes, you know, to see, because a lot of, you know, people, they, as soon as they talk, you know, they learn about tongue tie, then now everything is tongue tie, you know. But no, there's so many aspects of it. So the more that you learn from other practitioners and you actually educate yourself, I think that the more that you would be able to look at that child comprehensively and be able to say, oh, this may be like, you know, from the gut issues. This is like the, you know, the cranium issues. Or, you know, some of these things that it's kind of coming, let's work on this first and see if it resolved. And then then come back to this, you know. The timing of things is so important, you know. So those are part of the thing. I wanted to actually say, because I do have the thing. So this is one of my favorite books lately. Have you read this?
I haven't.
So I'm going to give that to you as a present, you know. So the gas book, it basically talks about the airways and the part of the brain specially that it develops that has more propensity for anxiety and depression.
Okay.
So and then it talks about so many things. These are 2 of my great colleagues, you know, so that they have been, you know, working on these types of functional medical doctors and things like that for many years, you know. And I found like everything that I talk about, you know, basically so many of these things are in here. So, you know, instead of just kind of giving them a 45 minutes lecture, I'm like, go read this and then we'll talk about it, you know. So that's one of my favorite books lately, about at least the airway health, you know, because it makes such a big difference. And they talk about so many things that we talked about.
Beautiful. And, you know, I feel like we're at just this ledge where there's so much that's being understood and put together. And you know, I think the work that you're doing, the work that Dr. Gill is doing, the work that a lot of people are doing is basically redefining parts of medicine.
Right.
And that's why I'm so excited to have you sharing what you know, because you are kind of reinventing your field.
Thank you. Yeah, I definitely didn't listen to everything that I learned in residency, and I just, you know, I think that question aspects of it, you know, when the osteopathy came to my life, And for the first time, I felt like, oh my God, the cranium moves. They told me it just like, it's all stuck together and there's no movements in there, you know, and it completely fuses, and, you know, and just that paradigm was just such a shift of paradigm for me. And then to understand that how when I'm making changes in this, you know, 2-3 bones in here, how I'm just completely changing the rest of the dynamic of this person. It just kind of, that was the time that I started questioning everything, you know, and I still have substantial, you know, knowledge from, you know, the residency, but I feel like I just kept like asking why, you know, like if they told me in dental school that tori, you know, that little bony part that develops on the roof of your mouth or on the sides of the bottom of your teeth inside, they're like, I remember, you know, they said, oh, there's no known reason for toris. And then once I went to some breathing educators and learned some of these different things from my functional therapist and buteyko breathings and all that stuff, I found out, no, that's an improper pressure in the sinus area and in the, you know, some of the breathing dysfunction, that it actually creates the bony part, much like the bunions on your feet, that it's like the improper pressure that is creating that. So, you know, I think all of those things, once you ask the why question, it just keeps leading you deeper and deeper. And then you become an advocate, you know, rather than prescription writer.
It really changes what you're able to do.
Exactly.
Well, thank you.
Thank you so much. Thanks for having me.
And thank you everyone for listening. This is Dr. K from Holistic Minds.